As my dear friend Fran Kaufman way back there so eloquently describes, we human beings are biologically hardwired to really like the taste of fat and sugar and salt. Anybody not like the taste of one of those three? I've actually started thinking that we could put on packaged food just like what level of fat, sugar, and salt is in each food, because pretty much everything we love to eat is just different proportions of these things, right? But the truth is, we evolved on whatever, the plains, when there wasn't access to these foods. There was no such thing as concentrated fat. The animals were living on the plains. It was survival of the fittest. There wasn't much fat. Sugar, there was no concentrated forms of sugar. You might get honey if you happened to be in a place where there were bees. And salt, unless you lived by the ocean, there was no concentrated forms of salt. And so as a result, the effects are pretty clear. Because what's happened? We've put the different combinations of fat and sugar and salt everywhere. And incidentally, we blame ourselves. How many of us blame ourselves for having this craving for fat and sugar? It must all be our fault. If industry did a study and said, who's to blame for all this food we're eating, we'd all blame ourselves, wouldn't we? I shouldn't give in to that craving. What industry knows is you don't have to, like 9 times out of 10, you won't give in. That works for them. 1 time out of 10, you will. Portion sizes. Industry spends $10 billion advertising their foods to kids. It's as difficult in many communities finding something healthy to eat as it is driving from here to San Francisco on Highway 5. Anybody try to buy something healthy driving along Highway 5? Almost impossible. So the weapons of mass destruction have been found, and they are everywhere in our communities. And it's not just food, it's activity as well. If you had the idea, if this gentleman here had the idea of walking to work, what gentleman, you say? Oh, there he is. And physical education, this is called physical education in most California schools. How many people are active? Do you notice that the teacher has high heels on? How many communities have parks like this? I do. I'm really fortunate. How many people have parks like this? This is a real picture from Santa Ana from America Bracho. In this park, you will get a ticket if you are active. And as America says so eloquently, these are the children of Santa Ana who don't have any parks, who end up playing in the garbage cans because they have no place else to play. And there is this debate, is this about individual responsibility or the environment? Which one is it? And it's the wrong question, because it's about individual behavior in the context of the environment, in the social, economic, and political world in which we make our food and activity choices. And the extent to which it's the environment, whether it's 5% or 95%, to that extent, public policy plays a role. As the Institute of Medicine has said, it is unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change. And if the problem goes unchecked, the results are going to be staggering. Just look at diabetes. Fran Kaufman sees diabetic patients pretty much all day, every day, and the numbers are skyrocketing. There is a 67% increase in diabetes death rates in California just in the 1990s. Type 2 diabetes that used to be called adult onset diabetes is now at epidemic levels. In 2000, 5 to 8% of Californians had diabetes. It's expected that of children born in the year 2000, 1/3 to 1/2 will have diabetes sometime in their lives. And when you think that 20% of healthcare dollars are spent on people who have diabetes, and that's when 5 to 8% of people have diabetes, what's going to happen to healthcare costs when those numbers double or triple? This generation of children could be the first in history of the United States to live shorter lives than their parents as a direct result of this food and activity environment. So we got involved in this at our inception. We started a grassroots campaign. We got some of our team leaders, Phyllis Cooper, who is our evaluation consultant, my right hand in that project, is here today. We began mobilizing moms and grandmas and teachers in their own communities, in 6 legislative districts. Hey, why would we organize things by legislative district? Right? We had a purpose in mind, to begin educating policymakers about this issue that no one had ever heard about, childhood obesity. And we then met Martha Escutia. And Martha, I remember that day. We showed you data on diabetes death rates by state legislative district, and your jaw dropped, and you said, let's do something about that. And we then worked with Senator Escutia for her entire Senate career. We got the first piece of legislation ever passed in this country, defined some nutritional standards, and we pilot tested them. And it was this bill that kicked off a national movement. It's now actually an international movement. Latvia has gotten junk food out of schools, I just saw online. And it was a series of wins. LA Unified then got soda and junk food out of schools. We got soda out of middle schools. And then the big win was once Governor Schwarzenegger came in. He signed Senator Escutia's legislation that we'd worked on for so long to get soda and junk food out of California schools. And as only the governor could do it, there was quite the celebration at the signing ceremony. And you can see that Martha and I are happy. We had been doing this a long time. But in terms of impact and tenacity, it works. We can win. We can go up against these industries and win. The following year, we took on physical education, and for the first time ever, money was put into the state budget to support physical education in California schools. The following year, we said this problem of obesity is not just in the schools. It is also in communities. It's where we all eat every day. And we joined with the Heart Association and the Cancer Society to sponsor legislation to require that restaurants, chain restaurants, put their nutritional information where it will be useful on menus and menu boards. Half of all food consumed in the United States now is eaten away from home. And unlike food that you buy in the grocery store that has nutritional information right there that you can use to inform your purchase, when you eat out, that information is not easily accessible. Instead, if you're lucky, you could go around the back of the restaurant, and right there near the bathroom, you'll see a chart like this in 2.5-point font that will tell you exactly what it is that you're going to buy. We got that bill through the legislature in 1 year. Pretty remarkable, right? Mary Lou Henrich from Oregon called at some point and said, we're going to do this in Oregon too. You can get it through in 1 year. It didn't quite go that easily, Mary Lou.